wasn't familiar with, and it does look like it's from chapter 54, anemia drugs. And that was a chapter that we didn't go over. Can we expect to have questions like that on the final from chapters we didn't go over in class?
Not much, but here and there you may see some questions, but that's not very common that we didn't cover and you'll get questions from all over. That's not going to happen. Again, it's just not possible to cover everything, but as I said, majority of the stuff, what you're going to see exam should have been covered during our lectures. Very high number. That's what you're going to see.
Okay, thank you.
Mhm. All right, so
God damn.
let's try to answer this question. You guys see my screen still there? All right, so let's look into that. Okay, yes, good job. Alrighty, yes, it stimulates the release of insulin from the pancreas. Perfect, perfect, perfect. So what is the biggest concern here with this medication based on the mechanism of action?
Hypoglycemia.
Yeah, hypoglycemia. Patient high blood glucose. We're trying to bring it down. The risk is hypoglycemia, and the risk is higher with this class of drug is because they stimulate the release of insulin, and insulin brings glucose down. Okay. Okay, yes, C, vasopressin, antidiuretic hormone. They're losing water, fluids, because they have diabetes insipidus, which is a hormonal disease. They have deficiency in antidiuretic hormone. Diuresis increase the loss. Antidiuretic, they decrease the loss of fluids. And because they're losing here, we need antidiuretic, which is vasopressin. Okay. Okay. All right, yes, C is the correct choice. The patient should have a decreased urine output. Calculation. Okay, great job. Yes. 2 tablets. Uh, okay. Excellent. Proud of you guys. Very well, very well. All well. Yes, C is the correct choice, guys. Silver sulfadazine. Silvadine is a topical antimicrobial or antibacterial, or you can say antibiotic cream for management of second, third degree burns. Okay. Nathan, can you adjust your camera, please? I don't see you on the screen. Okay, great job again. Yes, B is the correct choice. Propylthiouracil. Propylthiouracil. Okay. It's the same topic, same concern, but asked in a slightly different way. I'm glad you guys know it. So A is the correct choice. It's first trimester. Okay. How about this one? Nice. Yes, well done. Methimazole is the preferred antithyroid medication for managing hypothyroidism in the second, third trimester of pregnancy because it has a lower risk of liver toxicity as compared to propylthiouracil. Okay. Okay, good job. Yes, avoid eating shellfish because they may contain iodine. Okay, yes, great. C, abdomen. What is the most consistent absorption of insulin? Okay, so the correct choice is C, because by involving the patient in development of the nursing care plan, ensures that the plan is tailored, created to the patient's unique needs, their preferences and values, and that has the higher efficacy. Okay. Can only see 21 students answered. I don't know where's everybody else. Everyone awake? Guys, where you at? Carly, Soren, you're all right there? Okay. Nico, can you adjust your camera? So does Simon, can you adjust your camera, guys? If you cannot see yourself clearly, I cannot either.
Professor,
Nico?
I'm gonna log off in a
Okay.
second just because I have to pass through security.
Okay. Nico, can you adjust your camera? Kenzie, can you adjust yours as well? See if you can see your shoulders in the camera. On your screen, if you can see your shoulders, good. Nee, Angie, can you adjust yours as well? Applies to everyone, guys. Look at your picture. Can you see your shoulders at least? You're good. If not, please adjust. Eden, could you move it a little bit down, please?
My wire is too short, so this is the most it goes.
Okay. All right. So B is the super nurse question, right? Hold the dose, call a doctor. All right. Okay, great job. Yes. C is the correct one. Tell the patient to take it early. Otherwise, they'll be waking up at night to urinate because diuretics will increase the urine output. Yes, the correct choice is C. It takes about 6 to 8 weeks. All right. Next question. All right, yes. So diazepam will be the right answer here, which is a benzodiazepine used in acute seizure management because it acts quickly, rapid action. Okay. All right, yes, C is the correct bradycardia. Okay. Okay, yes, C is the correct one. It's a 1 hour window, 30 minutes before, 30 minutes after. Okay, that's a 1 hour window total. Okay, yes, D is the correct choice here. I should complete the entire course and not stopping even though they feel better. It's important to understand that it's important to complete all the doses. All right, all right, all right. Excellent, guys. Yes, B is the correct choice. Carbamide peroxide. It's an ear drop. It soften, loosen, remove the ear wax. Okay, yes, C is the correct one here. Lying sideways, always the affected ear up. Otherwise, the medication will just come out. Okay. Okay. I see here A and B. Make sure we're 100% clear. What is the right option? Now, what is the number? What is the year, the age?
3.
3 and
right?
under down.
So this
Above
is
3 is up.
above 3. So above 3 goes where? Above, right? Up and back. Up and back. So which one is up and back here? And then if you change the age, if they say 2 here, down and back, right? Okay.
I had a question.
Mhm.
What if it is exactly 3?
So if it's 3, I would say go down and back.
Okay. Okay.
Okay. Good question. Good question. Because practically, you see, it's because of the ear canal. That's why we do that way, right? So just turning to 3 is not going to change everything just because it's 3 now. It was 2 years and 9 months and 29 days at that time. So it's better that we stick to whatever the closest is that may be better absorption. Afterwards, we switch to that. Okay. Nice. Yes. This time around, B is the correct one here. So up and back. Back is for both. It only difference is up or down. That's it. And tilt the head slightly to the opposite side. Okay. Nice. Yes. C is the correct choice here because we know steroids can increase the blood glucose level, so we need to monitor it more frequently. Calculation. Good job. Good job. So here's your answer. Volume is 1000. Time, they give us 6 hours, correct? That's what they give us, 6 hours? Oh, 8 hours, sorry, 8 hours. So 8 hours, when we convert into minutes, so 8 multiplied by 60 minutes gives us 480 minutes. And then multiply the top part with the drop rate, or the drop factor, which is 15 drops per ml. And that's where you get this answer 31.25, because we're rounding the answer. It's below 5, so it will come to 31. Okay, great, great, great. Okay, D is the correct one here. Okay, perfecto. Next. Okie dokie. A is the correct choice. TSH, TSH, TSH. Now let's look into another question relevant. Okay, C is the correct choice here. Because in hypothyroidism, TSH is high and the other two goes opposite direction because they stay together. Okay, yes, B is the correct one here. Here TSH goes down, other two go up. Okay. Okie dokie, yes, A is the correct one here. Return demonstration. Okay. Yes, D is the correct choice here. Powder, 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 powder. Okay. Okay, yes, great. C is the correct here. 100% is available because it doesn't go through liver's first pass effect. Okay. Okay, B is the correct choice here. Tilt the head back and look upward before instilling the drops. Okay, 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 okay. Okay, another one. Okay, nice. Yes, A is the correct choice. Apply gentle pressure. Inner canthus here. For 1 to 2 minutes. Usually they say 1 minute. Okay. Okay, once again, well done. A, increase insulin dosage because we know it will increase the blood glucose level. So you need to adjust the dosage. And it should be an increase. Okay, for this question, the correct choice is B, glucagon. In case of severe hypoglycemia, the patient is unresponsive. You cannot give them anything oral. It's 45 blood glucose. So you need a quick action. So when they're unresponsive, give them glucagon, which help liver or stimulate the liver to release the stored glucose, and that will increase the blood glucose level. Okay, yes, C is the correct choice. It's rapid acting or fast acting insulin. Should ideally be administered somewhere, some say 5 to 10, 5 to 15, something around there. So 5 to 10 minutes before the meal. Perfect, perfect. C is the correct one here. Now that rifampin is known to cause a harmless, it's harmless. Red orange. Remember, red orange. This is the dark one. 3 R's. It causes dark, and there was another one which causes a little lighter. Okay. You can tell them to consume more fluids. ACE or ARB or beta blockers. These are the ones you will see most commonly given unless it's contraindicated. It helps reducing morbidity, mortality by blocking the adverse effects of your ROS, which is your renin, angiotensin, aldosterone system, which causes vasoconstriction and also sodium water retention. Okay. Okay, C is the correct choice here. Calcium channel blocker. Do you guys know what is another class of drug medication which can be used in these patients?
A thiazide diuretic?
Yeah, thiazide type diuretic. Yes, these are the two which are recommended. Come on, come on. Yes, A is the correct choice here. Vitamin K is essential for synthesis of the clotting factors such as clotting factor 2, 7, 9, and 10 in the liver, which are necessary for normal blood clotting. And when there's a deficiency, it can lead to prolonged bleeding, increased bruising, and elevated prothrombin PT time. Yeah, spacer device. It's usually recommended patients who have difficulty coordinating their breathing with the actuation of an MDA when you press it. So it helps to overcome the need for precise timing by holding the medication in the chamber. Excellent. Yes, B is the correct choice. Yes. Okay. Okay. Yes. Child growth. D is the correct choice. Okay, so I see mostly answering D. Now we're talking about receiving diuretic therapy. Nurse understand client risk of hypokalemia, low potassium. Low potassium in the blood can lead to MUSCLE, weakness, muscle weakness. Okay. So B as in boo is the correct answer here, not D as in do, okay? B is the correct choice here. Usually in the legs and arms, that's where the symptoms are. Okay, that was an easy one. So 35-year-old, it's adult patient, up and back, up and back. Okay, once again, just for clarity. Perfect, yes. So C, pulling the pennant down and back. Okay. I want you guys to read the question carefully once again. Other drugs may have been used, but hey, they're saying if they don't respond to usual treatment, then the answer is MANNITOL, mannitol. It is an osmotic diuretic to reduce the increased intraocular pressure in the eye. And usually when the usual treatment that are not effective. Okay. Yes, correct. B, it's an osmotic diuretic. It draws fluid out of the eye, reducing pressure in the eye. Okay, great. You guys want to take a break? Okay, let's take a 15.